Those are involuntary movements. Oftentimes, patients describe that, as if, I'm playing a guitar without a guitar, or I'm playing the piano without a piano.
Can you give us an example of some of the types of medications that could have a side effect of TD?
The most common class of medications are called the antipsychotics, although they're used to treat a really broad range of disorders, including bipolar disorder. All of these block the dopamine 2 receptor, and that's the mechanism of action that causes TD.
What are some common signs or symptoms of tardive dyskinesia?
Classically, it's orofacial movements, so it's pursing movements, grimacing movements, tongue darting, tongue moving back and forth.
And then there's yet other patients who sort of have these generalized involuntary movements that we refer to as chorea, where kind of the whole body is sort of being squirming around in an involuntary way.
It can affect even sort of balance and be really disabling.
A really important feature of TD is that not all patients will realize they have it. So it's our responsibility to do a regular assessment for TD type movements.
It's a condition that is sometimes unexpected because patients may have been taking these medications for a while prior to the onset of the symptoms, or they might even emerge after somebody has lowered the dose or discontinued a medication like that.
Making the diagnosis is key. I have seen many patients who have been to many other physicians who were thought to be malingering or making it up, and they're dismissed.
What are some unique challenges patients with tardive dyskinesia face?
It is a very visible disorder. Even in milder forms, it leads to social and psychological distress. Patients can withdraw. They may avoid meeting other people.
There may be individuals who understand that these types of involuntary movements might be related to the fact that the patient is being treated for a psychiatric condition.
For a patient who's really struggling with this sort of dual stigma of having a mental illness diagnosis as well as TD on top of that, what I would say is that there's definitely hope. I do feel really confident that in my 11 or 12 years of practice in psychiatry now, I've seen the stigma associated with mental illness decrease significantly over that time.
Whether it's migraine headaches, back pain, diabetes, high blood pressure, TD is a condition just like any of these. You are still the person you always have been. It's just that you have this condition. And as much as you can control it, as much as we can help you control it, then we will do that.